Okay, next up we have Andreas. Andreas has been a DeSci builder since 2001 and has been involved in CureDAO, FutureDAO, and SleepDAO. He's a contributor at VitaDAO and at CerebrumDAO, so really, man knows his ways around a DAO. But he will be chatting to us about HappyDAO today. Thanks so much.
Thank you. Thank you so much for the opportunity to talk to today in front of all of you. I really appreciate it, and I hope everything has been great for you so far at DeSci Berlin. Today, I want to introduce to you why the looming mental health crisis needs DeSci. So, depression and anxiety has been rising for the past 30 years, and with an even greater increase during the COVID era, where you saw during 2020 to 2021, there was an increase of 25% during only 1 year. And keep in mind that about 4 out of 10 adults, they experience depression or anxiety or know someone who does. I've even seen stats where they say that 33.4% of all people globally have either depression or anxiety or both. So this means that 25% during 1 year means hundreds of millions of extra people are actually having these issues. And even in 2021 in the US alone, there was almost 50 million Americans taking either SSRIs, SNRIs, or Wellbutrin. And ever since then, as you can see on the graph, it's only been increasing. So what are the limitations with the current first-line anxiety and depression medications? So right now, we're using the second generation antidepressants, SSRIs and SNRIs, that are the primary first-line treatments. And the funny thing with these is that they actually don't perform much better than the placebo in trials. And there are a host of issues with this, including things like loss of libido, weight gain, apathy, brain fog, and emotional blunting. Of course, all this leads to a big decrease in life-related metrics. And what about the second line of treatments? They're actually not much better. So we have MAOIs, monoamine oxidase inhibitors, for depression. And they are also insufficient for widespread use due to high maintenance, dietary and drug interactions, leading to critical issues such as a hypertensive crisis and serotonin toxicity, and even death in some cases caused by the dietary interactions and drug interactions, as well as this serotonin toxicity that has been, for a long time, thought as the cure of depression and anxiety, but in truth, it seems to not be at all. There are many new studies coming out showing that it's not the solution to this, and I feel like all these current drugs also highlights this. Then we have benzodiazepines for anxiety that can be effective in the short term, but long term is a different picture. Long term, they can be very addictive, and they can be also extremely difficult to get off because the withdrawal effects of these, they are horrendous. That means that people that are on them, sometimes they even choose to stay on for a longer time because it's so hard to get off, because they're feeling miserable getting off these medications. And that means that sometimes they like stay on months or years additionally just because they can't get off them, basically. And so right now we have a lot of issues in terms of the funding and the whole landscape of depression medicine. So of course you all know about the FDA process, which is working perfectly, as we all know, with a very lengthy and expensive process. And there's a big focus on drugs with high sales volumes, also called blockbuster drugs. And this is really hurting innovation. The thing is also, if there's one treatment for a specific condition, there's very little incentives to actually try to improve upon this, even if the treatment is really poor, which I think we kind of agree upon now is the case with anxiety and depression. And there's also a lack of focus on early stage research that focuses on patient outcomes in the real world, which is the only way to really figure out how much it is hurting people and how they can actually solve these mental issues. So what are the current limitations of the current measurement methods and tools in terms of solving or measuring depression and anxiety. So right now, we're using the Hamilton Depression Rating Scale, and despite it being the most widely used one, there are a lot of limitations in terms of this. So first of all, it was originally developed for hospitalized patients, which means that it was basically just focusing, or still just focusing on physical symptoms. And this means that there's no inclusion of symptoms such as anxiety, cognitive and sleep issues, and other daily factors that might be at play for people suffering from these mental issues. And there's a big bias in terms of this scale because the clinician judging each patient. And this means that it can change from a day-to-day basis, how they're feeling, their experience, and that means that different clinicians can think very different in terms of the actual treatment of each patient. And all this, of course, leads to a big increase in misdiagnosis, underdiagnosis, overdiagnosis. But the good thing is there are better tools available, but the bad thing is we are not utilizing them. So PROs, patient-reported outcomes, they include patients' own experience. For instance, we have the SF-36, which is a prominent example of such. It provides a lot more valuable information as it's constantly updated, and it's actually focused on symptoms that are based on daily life, how they're actually feeling, and not just their physical symptoms, like the current case with the Hamilton scale as I just explored. And they have a standardized scoring system, which also decreases bias. So clinicians won't have this bias basically changing the whole outcome of treatment. And there's a much broader range of symptoms included. So there are social, cognitive, and anxiety symptoms included in this. And also this is self-administered, which saves time and money because the clinicians don't have to make these assessments, which, as we all know, is a huge factor for science. Time and resources, we want to decrease that as much as possible. So let's talk about all this. There is a staggering 9 out of 10 people with mental health disorders that are feeling a big stigma in terms of discussing these issues. And this is negatively impacting their lives. So this is something we have to change. This is something we want to solve by encouraging education, promoting acceptance, supporting advocacy, and creating an open and positive community where people can actually discuss their problems and can actually find solutions. And the whole thing with this is also that we can maintain anonymous integrity, which basically can decrease the stigma that people are feeling because they can share with any name they like. They don't have to share their real name, and they can get the support they actually need. And all this is focused on improving patient outcomes in the real world. So we would love your feedback on this. DeSci is all about collaboration. So, of course, we want to also collaborate with other DAOs, other organizations that want to solve this crisis. We want to build this with all you input, also the ones on the live stream, everyone that are interested in this. So if you could scan this QR code and share your feedback, it would be amazing. Would really appreciate it from the bottom of my heart. And if you all got the chance to scan, the ones that want to, I'll go to the last slide. So if you have any questions, feel free to reach out. You can find me in the crowd, of course. Ask me any questions, any feedback. I'd love to hear anything from you relating to this or anything else you think would be relevant. You can find my email, my Twitter, QR code, and you can follow along with HappyDAO or your building. Help support it. Help join us. We are launching the Twitter as of right now. That's everything I have. I really hope that you will enjoy the rest of the conference. Thank you so much again for the opportunity. And thank you for everyone that pulled this together. It's been amazing so far. Thank you so much.